A great hygienist can be a game changer. Now, I teach a seminar to hygienists called How to Train Your Dentist. And it really is a great seminar that speaks to the hygienist on how to be a positive influencer in her office. And that's not what I'm talking about here. I'm talking about finding one that is already an amazing hygienist. And here's where it comes in. If you have a confident hygienist who is clinically skilled, as they should be coming out of hygiene school, but if they've had some experience, they're usually a little better, and very clinically skilled and gifted even at identifying, keep in mind hygienists are not legally allowed to diagnose, I get that, but they can identify problem areas in a mouth, communicate those problems to the patient, and then when the doctor arrives to do his hygiene check later, can re-communicate that same information to the doctor verbally, so the patient hears it happening. Of course, it's what's known as the talk-over technique. Everybody knows to do that. But if you have a hygienist who is sort of introverted or doesn't like confrontation, because every time you tell someone there's a problem in their mouth, whether it's a cavity or some gum recession, whatever, you know that's a confrontation. The patient doesn't want to hear it. It's funny, patients come to us to make sure their mouths are healthy. But when we tell them we need to do something to keep it healthy, we get a lot of resistance. There's a lot of disappointment. It's kind of like trail mix. You know the definition of trail mix, right? Chocolate and disappointment. So you go to the dentist for healthy and you get disappointed frequently because we're getting older and the teeth were only designed to last but so many years, and we're living way past that thanks to modern medicine. So people are going to have disappointments. If you have a hygienist who can let that roll off her back like a duck in the water, right? Then you've got a gold mine in that hygienist, because the work just seems to bubble up to the surface. I refer to that as the hygiene cauldron. It's not just my word, it's been thrown around. But the good work flows up out of that hygiene cauldron and lands on the floor for me to take care of it. And that's the responsibility, and hopefully the aim, of any good hygienist, to identify that treatment, help the patient understand what treatment is going to be necessary and why, so by the time the doctor gets there, it's sort of just a review of what's going on. I don't have to be the bad guy every time walking in. If you find a hygienist like that, you have found the hygienist that you want to work for you forever. Right now, I've got 9 hygienists in my practice. It's a big office, and every one of them fits that category. And when we find a hygienist who doesn't, they don't last long. In fact, they self-separate, meaning they understand who they are pretty quickly, and they let themselves go. They find another job. They're not up to our caliber, and off they go to some other dental office. So find those hygienists, educate them, help them. If you have someone who's not doing it, start teaching them how. Send them to my course. I'll teach them how to do it. But it's the one most important thing that you can have in your practice to make your life easy is a really gifted hygienist.